provide advice to the Chief Coroner respecting medical, legal, social welfare, and other matters that may impact public health and safety and the prevention of deaths. This death review panel into illicit drug toxicity deaths was called to review the 6,007 deaths that have occurred between August 1st, 2017 and July 31st, 2021. A death review panel held in 2017 had previously reviewed 1,854 deaths that occurred prior to that date. British Columbia has lost more than 9,000 lives since the beginning of 2016. This public health emergency shows no signs of abating, and thousands more lives are at risk. I am truly grateful for the efforts of the experts who participated in this panel. 23 senior leaders shared their experience, their expertise, and their wisdom in formulating the advice contained in this report. Agencies represented included the Office of the Provincial Health Officer, the First Nations Health Authority, Vancouver Coastal Health Authority, Doctors of BC, the College of Physicians and Surgeons, the College of Pharmacists, the BC Centre for Disease Control, the BC Centre for Substance Use, the Ministries of Labour, Education, Health and Mental Health and Addictions, the Canadian Drug Policy Coalition, and many learned others with first-hand knowledge and expertise of the risks and challenges associated with this public health crisis. I would also like to thank Mr. Michael Egilson, Director and Chair of the Coroners Service Child Death Review Unit and Specialized Investigations Unit, who led the panel and supported the drafting of the report. I am profoundly grateful for the time, energy, and dedication he gave to supporting the careful, thorough review of these deaths of members of our communities. It is my sincere hope that the efforts and considered advice of this panel will support the province's support to this public health emergency that has hurt so many and caused so much sadness and grief across our province, and that we will soon see positive change and prevent future loss of life. And I'd like to turn it over to Mr. Michael Egilson.
Thank you, Lisa. To begin with, I'd like to acknowledge with gratitude that the Death Review Panel was convened on the unceded traditional territory of the Coast Salish peoples. Illicit drug toxicity is the leading cause of unnatural death in the province, accounting for more deaths than suicides, homicides, motor vehicle incidents, drownings, and fire-related deaths combined. Before I talk about numbers, findings, and recommendations, I want to remind everyone that we're talking about people who resided across British Columbia in communities large and small, people dealing with pain and trauma, people living in poverty or employed supporting families, people young and old, healthy and unwell, people from diverse ethnic backgrounds, people just like everyone else. The continued toll of unintentional drug toxicity deaths has created devastating impacts on families, friends, and communities of the deceased. To provide some perspective, since the public health emergency was declared, more people have died than the populations of Revelstoke, Kitimat, Merritt, Hope, or Cumberland. More people have died than would fit in Save-On Foods Memorial Arena in Victoria. So how did we get here today? In 2015, illicit drug toxicity deaths increased considerably over the previous year, and in 2016, that number almost doubled, and the Provincial Health Officer declared a public health emergency. The numbers continued to rapidly increase, and in 2017, the Chief Coroner convened a death review panel which brought together experts to look at the BC Coroners Service data to see if any lessons could be learned that would reduce the number of deaths. The 2017 panel identified a lot of information about who was dying, where the deceased lived, challenges they faced in their lives, and most of that information is held consistent since that panel and can be found in the BC Coroners Service monthly reports on illicit drug toxicity deaths. The 2017 panel identified 3 areas to reduce illicit drug toxicity deaths. First, the need to provincially regulate and appropriately oversee treatment and recovery programs and facilities to ensure that they provide evidence-based, quality care and that the outcomes are closely monitored and evaluated. 2, the need to expand evidence-based addiction care, including opioid agonist therapies and injectable opioid agonist therapies, as well as a full spectrum of recovery supports. 3, expand drug use safety options. These recommendations are still pertinent today. Naloxone was made widely available at this time, and drug checking services, though limited, were available in a number of communities. There is much work still needed with respect to regulating, overseeing, and evaluating substance use treatment and recovery services. 2 inquests were held into deaths where people died as a result of toxic illicit drugs, and jury recommendations into those deaths were consistent with the 2017 panel findings. The number of people dying as a result of illicit toxic drugs continues to increase, and twice as many people are now dying as when the public health emergency was first declared in 2016. The Chief Coroner convened a second illicit drug toxicity death review panel in December of 2021, which I chaired, and I would like to personally thank the panelists for their participation, commitment, and insight. I will now identify the major findings and recommendations on behalf of that panel. Deaths are increasing both in numbers and in rates. The drug supply has become increasingly toxic. More drug toxicity deaths occur among younger adults. The average age is 42. Illicit drug toxicity deaths are ranked second after cancers for potential years of life lost. Indigenous peoples are disproportionately represented in drug toxicity fatalities. Individuals living in poverty and with housing instability are more vulnerable. Persons with mental health disorders or poor mental health are disproportionately represented. In addition to fentanyl, other substances were detected for most of the deaths. In more recent months, there's been a rapid increase in benzodiazepines detected in deaths due to illicit drug toxicity. Benzodiazepines depress the central nervous system and can make the reversal of opioid overdoses more complex. Naloxone does not counter the effects of stimulants or benzodiazepines. Those who died frequently accessed medical services prior to the fatal incident of the drug-related event. Deaths are occurring throughout the province. While the highest number of deaths occur in large urban areas, Vancouver, Surrey, and Victoria, the death rate showed that this issue spans beyond urban areas. And smoking is the most common mode of illicit drug consumption, and that's up almost 50% of those who died. Smoking was the mode of consumption. Although a number of provincial initiatives have been undertaken in an attempt to address the drug toxicity crisis, these initiatives have not been sufficient to stop the rising death toll. A new approach is required, one that includes a specific focus on the toxic drug supply. The provincial response to the COVID-19 public health emergency has demonstrated that urgent action, coordinated efforts, and new ways to approaching complex problems are possible and impactful. The panel recognized that addressing illicit drug toxicity deaths is a complex problem, and that urgent response is required commensurate with the magnitude of the current crisis. The panel identified that immediate action was needed in 3 specific areas, which I will elaborate on in a moment. The first, a safer drug supply. Second, a coordinated goal-driven provincial strategy. And third, an evidence-based comprehensive continuum of treatment and support services. The first recommendation is to ensure a safer drug supply to those at risk of dying from the toxic drug supply. Since the public health emergency was declared in 2016, more than 9,000 British Columbians have died because of an increasingly toxic drug supply. It's estimated that more than 100,000 people in British Columbia have an opioid use disorder. The first priority in addressing the illicit drug crisis is keeping people alive. One of the primary drivers of the historically high numbers of deaths is the growing toxicity and unpredictability of the street supply of drugs. Providing a safer drug supply of pharmaceutical alternatives is necessary to reduce the number of people dying due to the toxicity of illicit drugs. As the scale of current initiatives have been unsuccessful in reducing the number of deaths due to toxic illicit drugs, provincial emergency powers and further legislative tools may be required to ensure immediate action commensurate with the magnitude of the crisis. The most urgent priority identified by the panel is to make safer supply of non-toxic drugs available to people who are at risk of death due to dependence on the illegal drug supply. A safer drug supply on its own will not resolve this public health emergency, but is urgently needed to reduce the number of people dying at unprecedented numbers. Safer supply is a broad concept that exists on a spectrum from a medicalized model treating people with a substance use disorder to a non-prescriber public health model that provides a safer supply of regulated drugs to people. As people use drugs for a variety of reasons, a variety of approaches will be required to provide a safer drug supply to those who need it in the communities where they live. A medicalized model on its own is not sufficient to deliver safer supply to all those in need. We will not prescribe our way out of this crisis. A range of safer supply models will be required to meet the different needs of people at risk of dying as a result of toxic drugs. Those could include prescriber models, public health models, and community-based harm reduction models. The panel recognized the complexity of federal, provincial jurisdictional challenges, including required exemptions to Section 56 of the Controlled Drugs and Substances Act to support a safer drug supply to British Columbians. Nonetheless, both levels of government have demonstrated through the COVID-19 emergency health response that it is possible in overcoming legislative, jurisdictional, and resource barriers quickly in order to prioritize public health and well-being. The panel further recognized the critical importance of increasing meaningful engagement of a diverse range of people with lived and living substance use experience in all health system planning, design, and implementation to ensure the safer drug supply and distribution mechanisms meet their needs. Recommendation 2, to develop a 30, 60, 90-day illicit drug toxicity action plan with ongoing monitoring. The public health crisis is now in its 6th year and continues to worsen. Public health efforts to date have not been successful in reducing the number of people dying as a result of toxic illicit drugs. The public health response to COVID-19 has demonstrated a model of addressing a public health emergency that is urgent, evidence-based, responsive, directive, and publicly transparent. The response to COVID-19 has been able to address health, economic, and social needs beyond the healthcare sector and adjust planning and actions as the realities of COVID-19 changes dictate. As with the need for a safer drug supply, there is an urgency required in developing an action plan that establishes a management and governance framework, sets clear goals, targets, and deliverable timeframes for reducing the number of illicit drug toxicity events and fatalities. Given that Indigenous peoples are disproportionately impacted by illicit drug toxicity deaths, there is a need to recognize the ongoing impacts that systemic racism and colonial policies and systems have had on Indigenous peoples, families, and communities, and the legacy of intergenerational trauma. Responses to this crisis need to recognize and respect the resilience and strengths of First Nations communities and culture, the work of the First Nations Health Authority to address the toxic drug supply, the principles of Indigenous self-government, and the province's commitment to reconciliation. Any successful strategy will need to include the voices and needs of those utilizing the services. As part of an action plan, the Federal Minister of Health is requested to approve the province's October 2021 request for federal exemptions to decriminalize personal possession of illicit substances in British Columbia. Decriminalization is an important strategy to support people using illicit drugs to access services and begin to reduce stigma around drug use. Decriminalization further supports a shift from enforcement to a health response to drug use. Recommendation 3, establish an evidence-based continuum of care. Recognizing the immediate urgency in dealing with the safer supply in order to keep people alive, there is also a need for a comprehensive continuum of care, including evidence-based treatment to support those with substance use disorders. The previous panel in 2017 made a recommendation with respect to an accountable substance use system of care, identifying the need to provincially regulate and appropriately oversee treatment and recovery programs and facilities to ensure that they provide evidence-based quality care and that outcomes are closely monitored and evaluated. The approach to screening for and treating substance use disorders should follow the same evidence-based approach that would be used in developing, monitoring, and evaluating treatment for any other chronic health condition. There is still much work to be done to establish a regulated, evidence-based continuum of care. As many individuals experience varying degrees of severity of co-occurring substance use and mental health disorders, there is a need to better define and implement evidence-based care and less stigmatizing approaches to concurrent disorder care. Similar to the earlier review, many of the persons who died as a result of illicit drug toxicity had contact with multiple agencies. For example, healthcare service providers, ambulance and emergency responders, or community agencies. People who use substances may have other chronic health or mental health conditions that bring them into contact with physicians, nurse practitioners, emergency room settings, or clinics. These points of contact provide opportunities for further engagement, screening, support, and/or intervention. Building an evidence-based continuum of care requires an expansion of existing harm reduction services, health promotion and prevention planning, substance use treatment with an increase in the number of prescribers, psychosocial treatment interventions, recovery-oriented care, and an emphasis on coordination and communication across all systems and levels of care to ensure that patients transition through the system seamlessly with limited drop. The panel also heard that healthcare providers do not feel supported in providing services to people impacted by substance use, in addition to establishing a practice standard and training regarding assessing, screening, diagnosing patients for substance use disorders. Investments in delivering care are also required. In closing, I would like to emphasize the urgent need for action and recognize that in addition to addressing the illicit drug supply, there is a need for evidence-based services to support and treat people with substance use disorders. The panel recognizes that the current drug crisis is complex, but COVID-19 has shown that addressing the magnitude of a public health emergency with actions commensurate with the problem is possible. Thank you. If you have any questions about the report, I would be happy to answer them on behalf of the panel.
Thank you, Michael. A reminder to media joining us today to please press *1 to join the queue for questions. You'll be limited to one question and one follow-up. And our first question today comes from Moira Whiten, the Tyee.
Hi, good morning. Thank you so much for taking my question. Mr. Egilson and Ms. LaPointe, I have a couple of questions regarding what has changed in this report from the report you issued in 2018, and can you speak to the, I guess, how you perceive the province's actions responding to the changing elements of this crisis, including drug toxicity and the nature, the methods and kind of profiles, I suppose, of people who are dying?
Thank you. I would say that in terms of who's dying, when they're dying, how they're dying, those kinds of things, the Coroner Service is reporting out on that consistently on a monthly basis. And since the last panel, there hasn't been a lot of change in those circumstances. What we have seen is the drug supply becoming more toxic. we've seen an increasing number of deaths, and we've also seen that though, and the report acknowledges, there have been certainly a number of interventions by the province, that those have not been sufficient to reduce the number of those deaths. And I think that one of the major thrusts of the panel's recommendations is recognizing that if what we're currently doing isn't working, we may need to be looking differently. And so if we're confined to a particular set of circumstances and responses, as we saw with COVID-19, what we sometimes need to do is change the rules. And some of those rules may be around who's involved, emergency powers to access more funds. But really, I think that the emphasis in looking at 6 years in is on the urgency of actually responding in a way, and specifically to begin with, around a safer drug supply to reduce the number of people dying.
Moira, do you have a follow-up?
I do, thank you. We saw a statement today from the minister responsible regarding the report, saying that, you know, it reaffirms the province's commitment to doing saving lives. But, you know, she didn't appear to address the, you know, the evidence you've laid out here that the province's response isn't sufficient. What optimism, or do you have any optimism to share that this report will contribute to the province turning around the crisis? And if not, where can people who have lost loved ones or drug users themselves look for solutions?
I think that the recommendations coming out of the panel and with the sub-actions under those do provide good guidance. There was a really well-rounded group of experts providing that advice, and I think that it will be important for a response to really take seriously the sense of urgency, and again, looking at some of the modeling that was done with COVID-19. It's clearly a different kind of public health emergency, but really what's being looked at is what were the resources brought to bear? How did we look at that problem differently? How did we pivot when things changed? And that's the kind of approach that's recommended in this report, and I believe would make a substantial difference in reducing the number of deaths due to toxic drug toxicity.
Our next question today is from Andrea Wu, Globe and Mail.
Hey, thanks for taking my question. For Mr. Egilson, the Chief Coroner appointed members of the panel who were mandated under the Coroners Act to share their personal knowledge and expertise, and that need not reflect policies or official positions or organizations. I note that there are panel members who are representative of organizations that have an important role to play in implementing some of the very recommendations contained in this report. So one example is we've heard from physicians prescribing safer supplies say that they've been audited by the College of Physicians and Surgeons of BC, and they view this process, the scrutiny, the stress, the paperwork, as a deterrent to such prescribing. Dr. David Unger, Deputy Registrar of the College, is a member of this panel. Forgive my confusion, and this is only one example, but does he, as a representative of the college, not have a direct role to play in addressing some of these obstacles?
Thank you for your question. So the chief coroner in appointing people to the panel is certainly looking at people who may have content expertise, have process expertise, and personal expertise around some of these issues. And so in bringing together the people, certainly those conversations are involved in looking at providing advice to the chief coroner in terms of getting input from all parties, and that's what you see reflected in this report.
Andrea, do you have a follow-up?
Sure. If these recommendations are not meaningfully implemented, and another 200 people die this month, another 200 people die next month, who is responsible?
Well, I think that we're probably all responsible. And I think that that's, again, one of the emphasis is that there's an urgency for all of us, for all of our organizations, and to really be thinking outside of the box and recognizing that to date, though there may have been or has been much activity, that activity has not been sufficient to reduce the number of deaths. And that's really where we need to get to, and we need to get there quickly.
Our next question today comes from Lisa Cordasco, Vancouver Sun.
Thank you very much. I wanted to refer to page 6 of your report, where it says that on April the 11th, the federal Minister of Health will give you that Section 56 exemption. I just want to confirm whether that's a hope or that's a fact. And if that is a fact, what will that mean in terms of accessing safe supply? Is it a game changer?
It's a recommendation. All of the advice that's come out of this report are recommendations, and the recommendation around decriminalization, as I mentioned in my remarks, is really important in that it signifies for people who are involved or using illicit toxic drugs that you're not going to be facing criminal sanctions. It certainly reduces stigma, and I think what it really also does is signal the importance of a shift that this is a health issue, not an enforcement issue. Decriminalization certainly also provides greater safety for people if they've had their drugs confiscated. That may create other safety concerns for them trying to obtain more supply. But I think really the big push with decriminalization is it signals that this is a health issue, and it supports people coming out and getting the services and supports that they need.
Lisa, do you have a follow-up?
Yes, thank you. The reason I ask or I focus on that is because, you know, report after report by the coroner talks about the toxicity, and that is, well, obviously the #1 cause of death. And every time in response, our Minister of Mental Health and Addiction points to the federal government as somehow blocking that path to better access to safe supply. Is that true? And are we stuck here until we get federal government action?
As I had mentioned in some of my comments, the certain panel certainly recognizes there are some jurisdictional issues about what province has responsibility for and what the federal government has responsibility for. And again, I point back to the response to COVID-19 about how those legislative and jurisdictional responses and responsibilities were quite quickly and appear to be easily put aside in order to address, another serious public safety issue. So I come back to the notion that came through loud and clear in the panel is a different way of doing business about thinking this is needed. And part of that certainly will involve federal government involvement.
Our next question today is from Kier Junos, City News.
Hi, good day. How would the report's recommendation of an expanded safer drug supply, how would that differ from the current prescribed safe supply model now, given that many have criticized the current model as too difficult to access?
Thank you for that question. So, again, as I noted, we can look at safer supply on a continuum, and to date, that's primarily been through a treatment prescriber model, And what we are suggesting is we're not going to simply prescribe our way out of this crisis, that we need to be expanding the models of safer supply to look at some public health models and community harm reduction models. There are other ways of actually doing that. And again, I come back to that's probably going to really require thinking about things differently. And that may mean needing to enact other emergency powers, look at legislative changes, but it really, the requirement of looking at this holistically and more broadly. If we think about a picture of an envelope or a box that we're working in, it may be that we need to knock the sides of that box down and increase our options.
Keir, do you have a follow-up?
I do, yes. Would that continuum ever consider being able to offer safe supply to those without substance use disorders or opioid use disorders? Is that a possibility?
I think when we were looking at the issue of safer supply, we certainly acknowledged that not everybody who died had a substance use disorder, and the importance of ensuring the safety and well-being of British Columbians.
Our next question today comes from Chad Pawson, CBC.
Yeah, thank you. Sorry, just two things. The one is you said the average age of the death is 42. Do you have like a kind of like a timeline of what it was before?
Unfortunately, I don't have that directly at my fingertips. Certainly could follow up with Ryan. I could get you that information.
Chad, do you have a follow-up?
Yes, my follow-up is for Lisa. Lisa, what are you doing to demand from provincial and federal ministries that safe supply be established and personal possession be decriminalized?
Thanks for your question, Chad. So the Coroner Service isn't in a position to demand. We use the tools that we have, and those are death review panels. We've now held 2 death review panels into the drug toxicity desk, where we bring together people with expertise and influence. An earlier question referenced the College of Physicians and Surgeons. It is our hope in inviting senior leaders to the death review panels that they have the influence to support change within their agencies and ministries when the recommendations are received. And we've held inquests, as Michael noted. We've held 2 inquests into drug toxicity deaths, and juries have made very similar recommendations. So our role is to investigate the deaths, present the facts, and where possible make recommendations to prevent similar deaths. And we have been doing that. We release our data every month in the hopes that it will support meaningful evidence-based change. And now, of course, with this death review panel, with some really thoughtful recommendations aimed at turning this crisis around, it is my sincere hope that those in positions to influence change at a very senior level will acknowledge that that some very courageous change is needed. We've seen that doing things the way they've always been done has not been successful, has got us to where we are today. And we've also seen that there are changes made, but as Michael mentioned, sometimes those changes are being made in a box that just isn't a good fit. And maybe it's time to, as Michael suggested, take down the sides of that box and think about this differently. And that would include, for example, different opportunities for the provision of safer supply. If we're serious about saving lives, then we have to think differently about this, and we have to meet people where they are. And I also recognize again and again in the report the reference to including people with lived and living experience in the decision making, having them at the tables, because they have the knowledge, and ensuring that they're part of helping to assess the best way forward.
Our next question today is from Ahmad Agahi, Global News.
Thank you so much. And I just want to go back and try to understand a little bit more for people where the disconnect may be. So if advice from 23 senior leaders in this field contained in this report to implement some meaningful safe supply program does not come to fruition, dare I say this quarter or this year, then what will?
I think that's a fair question. And I can reiterate, as a coroner service, we will continue to publish the facts. This panel has recommended some approaches that are a little bit broader than what's currently in place. At the end of the day, it's up to the people of the province to ask their elected officials to make the changes that they think are important. And I would expect that I certainly know from the many families I hear from communities across the province that this is a burning issue for them. And I would expect that, I suspect that many of those in elected positions are hearing from those same families. And I hope that we will see this meaningful change. I don't think anybody wants to see another 2,200 lives lost next year. Because we are losing valuable members of our communities, as we all know, and it's the life expectancy of this province has decreased as a result of illicit drug toxicity. That's a pretty significant fact, and I do believe that there is a real desire to change this around, and I hope that the panel's recommendations will support that meaningful change.
Ahmad, do you have a follow-up?
Yes, thank you so much, Lisa. And it kind of leads to the next question I wanted to ask. Do you think there needs to be a better way to communicate to those people in the province who have not been personally affected by the crisis about its urgency and what clearly appears to be the impact now with so many deaths on the overall well-being of the province? Because if perhaps it hasn't impacted someone now, the way things are moving, it certainly looks like it could in the future. And is there any way to get through to those people better? I know the reports have helped over the last few years, big time, but can more be done on a provincial level with messaging like we saw with COVID, how everyone got the importance of that through messaging from the province on a big scale?
Well, I certainly think that awareness of this public health emergency is growing. We know it is a fact that COVID-19 really occupied much of the time of many of those in positions of authority in our province, and for good reason. And sadly, I think one of the unintended consequences of that preoccupation was that the social isolation and the lack of opportunities for overdose prevention sites had a really negative impact on those using substances, and we have seen deaths rise to an historic level, which has been tremendously sad for so many families. And there are, I have seen an advertising campaign by the province, certainly around stopping the stigma, encouraging people to call if they have a substance use problem. And I think certainly the panel's recommendations around an evidence-based system of care, supporting clinicians and those in the healthcare world to assess and advise people experiencing problematic substance use or even casual substance use, helping people understand the risks and helping people know the solutions, but then having solutions there. And I think that's been one of the big challenges that we've seen in this crisis, where people are aware of the risks and people are looking for help and they have not been able to access it, particularly in smaller and more remote communities. And we have seen the rate of death rise alarmingly. So 100%, there needs to be more awareness of the risks. The panel has certainly provided a real sense of urgency in helping people understand what needs to happen quickly, and maybe supporting. Michael mentioned that those prescribing in this world currently are not feeling supported. So how do we support clinicians to help those who are experiencing problematic substance use? There's all sorts of different avenues that can be explored. And again, I'm just very hopeful that the wise advice of these 23 people will help with that.
Our next question today is from Camille Baines, Canadian Press.
Hi, and thanks for taking my questions. I'm wondering, a lot of what we've heard today regarding safer supply, the continuum of care, and also comparisons with how we've responded to COVID, these have all come up before. How do you think having the targeted dates in this report could possibly help, and how will you be following up on that?
Well, thank you for your question. And I'm going to turn that question over to Michael as chair of the panel, because he can better, I believe he's in a better position to explain where the panel thought that these recommendations would be able to make a difference. So Michael, I'm going to ask you to come up, please.
Thanks, Lisa. Just before I get to that, I'd like to make a quick comment on the previous question about creating greater awareness. Part of one of the recommendations identifies the importance of actually getting transparent information out, and certainly we've seen the model of disseminating information about COVID-19 on dashboards, about metrics, and something similar to that or along those lines is would really be helpful, and that's part of one of the recommendations. In terms of if I understand the question correctly, and if I don't, please repeat it, but that similar kinds of calls have been made before. Why would we think that this would have an impact? I think that there clearly have been lots of calls from lots of people around lots of things in trying to focus, I guess, two things of really trying to highlight this sense of urgency and also trying to highlight a sense of really needing to be thinking out of the box and expanding what can be done. If we look at, for instance, the flooding that we had earlier, how quickly emergency powers came in to communities and roads that were completely devastated, and began the important work of restoration that was needed. And again, looking at this emergency, it's not the same as the flooding. It's not the same as COVID, but there's a sense that if we use some of those same levers, emergency powers, looking at the resources necessary, commensurate with the crisis, I do believe that this could really make a difference.
Camille, do you have a follow-up?
I do. We've also previously heard about the issues around prescribers. Do you have any targeted dates on how colleges could respond and how specifically prescribers could be supported?
Well, it's yes, and it's not just prescribers that is being discussed. It's people in addictions medicine and doing substance use care in general. The recommendation, I believe, was looking at 2 months to be thinking about a framework about how we can relook at how some of this regulation works. It's also thinking about that, as I had mentioned, we're not likely to prescribe our way out of this, and that we need to be thinking more broadly about some other models, such as some public health models and community harm reduction models. So I think that's was a sentiment that was noted quite strongly in the panel, that we really need to be thinking more broadly along a continuum, certainly including the importance of prescribers, but that it needs to be broader than that.
Next up today, Les Lane, Times columnist.
Oh, thank you. Mr. Eglinton, you reported 4 years ago a similar report as today's, and you had 3 big recommendations, about a dozen bullet points on things that were needed to be done based on the numbers you were dealing with at the time. And you've obviously, everyone's conceded that nothing much is working on what's been done to date. Could you estimate what share of your earlier recommendations were actually executed by the government? And if why did they not work? Were they just not executed, or were they just kind of the wrong ideas?
So if I looked at that, and thank you for that question, if I looked at that in terms of an emergency response and ongoing support and care, I think that the energy went into the emergency response. And it's I think, easy for some of us to forget that at that time, naloxone wasn't available, without a prescription. And if we look at how widely available that has been, and it certainly has prevented a lot of overdose events. So I don't think that it's a matter of nothing was done. The notion of drug checking was really a very novel concept, and though it certainly hasn't been as widely implemented as would be helpful, it certainly gained some traction. So I think there was some real action on part of government around that emergency response piece. We've certainly learned some things since then, but as I noted in my comments, the recommendation around the need for a regulated, evidence-based system of care, there is much work to be done on that, and I don't think anybody would disagree that recommendation clearly was not fully implemented. And it's important to be thinking about these things combined, that we need the emergency response, as we have in this report as well, around the importance of a safer supply. But that in and of itself isn't enough. We also need to be looking at what are we doing to support people, to make services available, accessible, when they need them, that are actually meeting their needs. And again, that's complicated, and it gets even more complicated when you start looking at some of the needs of rural and remote communities and issues about accessibility.
Les, do you have a follow-up?
On safe supply or safer supply, do you picture, I'm just picturing someone buying a street drug and taking it in to be checked. And I don't know what happens then. If are they told that here's what's in it, FYI, and that, or are they told this drug is probably going to kill you? We can't let you have it. What do you picture happening in that regard?
Right. So, again, thank you for that question. In terms of drug checking, there's a couple of things that are helpful. One, as you mentioned, people being able to bring their drug to have it analyzed so that they know what it is they're taking, because the illicit drug supply likely isn't going to go away tomorrow either, and it's going to take some time to get a robust and meaningful safer supply out. So yes, that certainly is one of the important aspects of drug checking, is that people would be able to go in and know what is in their drugs. It's not about confiscating the drug. Another value of drug checking is it also allows some provincial surveillance and community surveillance about if the drug supply, illicit drug supply, is changing, and if there are things that would require perhaps a community warning, or just knowing what it is that's in the drug supply.
Our next question today is from Shannon Waters, BC Today.
Hi, I also wanted to ask about the recommendation, one of the recommendations from the previous report, specifically the one around a need to provide provincially regulated and appropriately overseen treatment and recovery programs. The province has made significant investments in increasing treatment and recovery options over the years, and I'm wondering if you feel that that recommendation has been implemented adequately, and if not, what continuing to pour money into that system means.
It doesn't appear that it appears that money has been poured into various aspects of treatment and recovery, but that's not the same thing as actually having a regulated system where it's evidence-based and outcomes are monitored. I mean, what we should be seeing is that, as we would with any other chronic disease, is that we would continually be learning, and we would be evaluating our treatment outcomes and reporting out on those, and understanding what's working well and what's not. And as a note in this report and in my opening remarks, that recommendation from 2017 still appears to need a lot of attention.
Shannon, do you have a follow-up?
I do. So we've had this year's budget delivered already, and there's no new money that's being dedicated to virtually any of the programs that the province offers in terms of responding to this crisis. I'm curious, without any additional funding being dedicated to realize the recommendations made in this report, what do you think the chances are of, you know, the province's response improving and BC not seeing the thousands of people die due to the toxic drug supply that we saw last year?
And as the report notes, it's essential to bring solutions commensurate with the crisis, and there is mention throughout the report about the importance of, if what's currently available isn't sufficient, to be thinking about emergency powers and accessing other resources that are required. Clearly, it is a large task in front of us, and it certainly will require resourcing, again, commensurate with the crisis that we're in.
Our next question today is from Dustin Godfrey, Burnaby Beacon.
Hi, this one's for Lisa Lapointe. You said at the onset of this press conference that you sincerely hope to see change resulting from this. Based on how the government has responded to your recommendations, or like your, the things that you said in the past, how confident are you that they will? And at what point do you kind of stop being hopeful and sort of go beyond your role as a coroner and, like, I don't know, more publicly appeal on a more personal level to the officials who are personally responsible for this?
So I do meet regularly with senior leaders at the Ministry of Mental Health and Addictions. I certainly have spoken on many occasions to the minister, and I believe that the will is there. There's certainly the desire to achieve the goals that we as a coroner's service have, which is to reduce deaths. There's no doubt about it that seeing these numbers of people dying month after month, year after year, is heartbreaking for everybody. And as a coroner's service, as the chief coroner, I do have the authority to bring a panel. So I can work within the authorities that I have. And we invited some very thoughtful, experienced senior leaders to that panel. And they provided some very thoughtful advice. And it is my sincere hope that those in a position of authority, many of the recommendations are recognize that this is a complex problem. So in addition to going to the Ministry of Mental Health and Addictions, they're going to the Ministry of Health, they're going to the CEOs of the health authorities, they're going to the First Nations Health Authority, and recognizing that it's going to need everybody at the table, treating this as the crisis that certainly I see it as chief coroner, and certainly the families that we as a coroner service are speaking with every month, seeing it as a severe crisis across our province. And really hopeful that bringing those minds together with the urgency that the panel has recommended. So there's some really aggressive timelines, 30, 60, 90 days, and looking for what is the plan? What is the plan? And I don't think anybody expects that there's going to be a fully fleshed plan within 30 days, but starting to develop the framework for what does that look like in combination, health authorities, Ministry of Health, Ministry of Mental Health and Addictions, First Nations Health Authority, that this is a very, very much a provincial problem, very much a provincial challenge, and it's going to need a provincial solution. And as chief coroner, I've certainly spoken to many, many people. I've spoken to all of those on the panel many, many times, and there is a desire to change, and I really appreciate the panel's outside the box approach, that if what is being attempted inside the box is not working, then it's time to change the box and utilize some of the extraordinary powers that are available. Because if we really do want to ensure that we don't lose another 2,200 members of our community in 2022, then there needs to be some really courageous, different approaches taken. And I do believe that if those are taken, as Michael said, that we will see meaningful change.
Dustin, do you have a follow-up?
Yeah, and this one's from Michael Egilson. You said to an earlier question that we are all responsible for sort of the lack of response from the provincial government. But I don't know, who does the buck stop with? Is it the Minister of Health, the Minister of Mental Health and Addictions, the Premier? And I don't know, what are your thoughts on calls in recent months for Sheila Malcolmson to resign?
Well, when I said that we're all responsible, I think what I really am referring to is not just government. Certainly government has a big responsibility, but as citizens of the province, making our views known about how important this is, about supporting families who have members who may be struggling with a substance use disorder. Certainly the Ministry of Mental Health and Addictions, the Ministry of Health, and service providers also have a responsibility. It's not a matter of there's going to be one person who is going to make everything better. I think that's why we need to be thinking outside of the box about who needs to be involved, and in that regard, I suppose I actually am hopeful in that we have seen, and I do take great hope from this, we have seen how with COVID-19 looking at things in extraordinary ways is how quickly actions have been able to take on just a scale that I would argue was probably unimaginable just a couple of years ago.
And our final question today comes from Mary Brooke, Island Social Trend.
Hi, thanks for taking these questions today. So many times today you've mentioned about doing things differently outside the box. I'm wondering how much your panel discussed the social and economic causes of the despair and the disenfranchisement that people experience, which leads them to wanting to take an escape, whether it's just on a leisure use basis or they become addicted. And with the depth that they may have discussed,
which ministries are you pointing that to deal with education about systemic societal change, and specifically a lot of exclusion that happens in society, and people feel left out and they kind of tip over the edge?
Yeah. Thank you very much for that question. In thinking outside the box, clearly when we talk about an evidence-based continuum, it absolutely needs to address a number of things that you're talking about, the whole deprivation piece. So that's really about bringing together right from a health promotion part of the continuum all the way up to intensive treatment services. And so that's going to involve education. That's going to involve housing. It's certainly going to involve mental health. It's going to involve community agencies. And as Lisa identified, and it really couldn't stress any more supporters strongly enough, is the importance of the people affected themselves and their families, about what's going to work for them, what do they need. But you're completely right that simply providing a safer drug supply is not going to resolve this in and of itself. That's really a key component to keeping people alive, but we really need that continuum of support services to help people, and it's not, for as you point out, it's not simply going to be about the physical addiction to a particular drug. There's certainly going to be housing and a number of other things for a number of people who have some other challenges, and those all are going to need to be addressed if we're going to make meaningful inroads into the quality of these people's lives.
Mary, do you have a follow-up?
Yes, thank you. So you mentioned today about there are various points of contact with physicians, nurse practitioners, emergency rooms, and clinics where engagement and screening could happen. How much of that is happening now, and what do those practitioners in those range of settings need to start digging into this problem?
So one of the recommendations is about a practice standard around that and further training, but I think you've hopefully picked up from some of my comments today that those practitioners also, in terms of screening and referral, are going to need services to refer people to, and those services need to exist on that continuum to meet the variety of needs. They need to be evidence-based, they need to be accessible, and they need to exist.
That concludes today's event. Thank you, everybody, for joining us today.